Thanks for organising this event and thank you for accepting our abstract. I'm here on behalf of two colleagues, Dr. Frank Houghton from TUS and Professor Ronan Foley from Maynooth University. And I'm going to talk to you about a paper that we had published earlier this year where we looked at licensed premises and their density around schools in Ireland, with a particular focus on whether the school was in a disadvantaged area or whether it was a DESH school, as many people will be familiar with. So I'm just going to talk you through kind of why we did this study, what our findings were and the recommendations. So as you'll probably be familiar with this infographic, we continue to drink quite a lot, but we have seen a decline in alcohol use. It's been a 10% decline since 2018, since the legislation was introduced. Can't be exactly attributable to the legislation, but we'll take it. But we still drink quite a lot, and this 9.9 litres is the equivalent of every man, woman and child in the country, child aged 15 years and over, drinking the equivalent of 2 bottles of wine a week. And as Isabel said, there's actually a high percentage of non-drinkers, so it's actually an awful lot more. Adolescents, we've also seen a decline in youth drinking, but by the time you get to 17, the majority of adolescents have started to drink, and it's more common than not that they will have been drunk as well, and high rates compared to other European countries of drunkenness. And our alcohol use is not without its consequences. Very strong association between suicide and self-harm and alcohol use, and a very high prevalence of alcohol use disorder among young people. So why did we carry out this study? It was, on the one hand, that we have this amazing legislation, the Public Health Alcohol Act, world leading. We've heard a lot about it. It is excellent. It's WHO best buys. It's everything that we almost everything that we'd hoped it would be. It, at its core, is obviously a decline in population level alcohol use, but we particularly wants to focus on delaying or preventing alcohol use among young people. And Section 14 of that Act is the prohibiting alcohol advertising within 200 metres of schools. So that was all great. And then we had COVID. And then we had everything that followed. And the pubs and restaurant nighttime economy basically was closed for long periods of time, not off licenses. So the government decided that we needed to stimulate economic activity and reward the nighttime economy for what they had suffered during the COVID period. And 2 pieces of legislation have been proposed, not yet enacted, but the Sale of Alcohol Bill of 2022 and the Intoxicating Liquor Bill of 2024. And there's a lot of components to those pieces of legislation, and a lot of it you can't argue with. It's about streamlining the licensing process. But of concern to us here and anyone who works in public health are these 2 pieces that are they propose to increase the number of licensed premises and to extend the opening hours. And this is obviously of concern to us. So as I say, it's not yet enacted, but they are of concern. So what's the harm in alcohol availability? Philip this morning talked about the 3 A's, but adolescents are just completely influenced by their social, environmental factors. There's advertising, affordability and availability or accessibility. They're no different to the rest of us. Alcohol is widely promoted in our society. Children tell us in our surveys that it's very easy to buy alcohol where they live and go to school. And all of this normalizes alcohol use and acceptance of use. And it's interesting, in the paper, we just looked at a little bit of the literature around the world to look at, what's the harm in alcohol availability. And it really does have an impact on adolescents. It leads to earlier alcohol use, higher rates of adolescent drinking, truancy from school, disruptive behaviour in class, and lower academic achievement. And all of this has been specified in the literature. So we're not, it's there. It is a problem. We also looked at, in a separate project, we looked at the licensed premises in Ireland. This map just shows you that we're well served. We have the 3rd highest number of pubs per capita, and 3/4 of us in the population of Ireland live within very easy walking distance from a licensed premise. So getting to the findings, we looked at the number of licensed premises within 300 metres of schools. So you can see that there are 2 licensed premises within 300 metres of all schools in Ireland. A slightly higher level around disadvantaged schools and 2.61, and non-disadvantaged schools 1.75. We looked then specifically at national schools, primary schools, and you can see here that primary schools are categorized kind of differently in terms of their disadvantaged status. And this here was a significant difference. So those in the disadvantaged urban 1 category it's very obvious from the graph, there were more licensed premises, 7.7 licensed premises around those schools. Looking then at secondary schools, there were no significant difference here, but you can see that there's a higher number of licensed premises around secondary schools, on average 3 licensed premises. So in conclusion, this is the first time it's very simple study. We use publicly available data in that we had the revenue list of licensed premises, and the Department of Education have an excellent list of all the geocodes of the schools. It's the first time that this has been done in Ireland. It highlights that there is a high number of licensed premises around all schools in Ireland. The findings are of concern considering the alcohol harm paradox, which is where those in disadvantaged areas drink the same or even less than those in affluent areas, but experience more alcohol-related harms. And it's important to just highlight there are 3 licensed premises within walking distance of all secondary schools. So this, we would hope, would form part of the health impact assessment. That was a recommendation from the Oireachtas Justice Committee, to consider this as part of that evidence. If we really wanted to aim blue sky, to strengthen the provisions of the Public Health Alcohol Act, because licensed premises within the vicinity of schools, their signage, they can have as much signage as they want. And when you think of umbrellas and awnings and things like that, children are very much exposed to them. To carefully consider any additional licensed premises, especially around schools and areas of disadvantage, and to empower communities. You can object to a premises within your area if you feel that there's enough or that there's alcohol-related harm. So you can object to a licensed premises and do it. So this was published. This is the paper, Open Access, published earlier this year. Thank you.